Joining us next to talk about specialty care for men is Dr. Andy Maes, a urologist with ThedaCare. Dr. Maes, thanks for being with us.
Thanks for having me.
So to start off with, can you just tell us about the care that you provide and maybe some common reasons that men come in to see you?
So I'm a general urologist, so I'll see anything from patients with kidney stones, bladder problems, prostate problems, and really anything in the urologic spectrum that we can help with.
And what do you tell those patients who might be a little bit hesitant or worried to come in and see you?
I like to start with some of the basics and ask what they want to do for the remainder of their life and how do they want to live that life and what are some things that I can offer them to help them out.
Okay, that's a good place to start. To explore some frequently asked questions and common men's health concerns, we put together a little quiz for you, Dr. Maes.
Wonderful.
Okay, don't be too worried here, but let's go ahead and get started with the very first question. So, this one's true or false? Every man should begin prostate screenings at age 40.
So this is test taking 101. If you see an every and that, you should immediately think false, okay? And this one holds true there. By every man at age 40, there are certain individuals, those who have maybe a genetic predisposition, so that would be those that we consider African American, have a black heritage, or those who have a first degree relative, dad, brother, uncle, with prostate cancer that was diagnosed at an early age. They should talk to their physicians about being screened early, but as a general rule, not every man at age 40.
Okay. All right, next question here. Again, another true or false. If I don't have any symptoms, I don't need to worry about prostate cancer.
Well, I wish that were true. Unfortunately, most gentlemen are diagnosed with prostate cancer without symptoms. If we do diagnose them late because of symptoms, often that's an incurable state. Mm-hmm. And so fortunately, when we diagnose them at an earlier treatable state, that is hopefully a curable condition.
Okay, all right, that makes sense. Our next question, this one's changing. This one's multiple choice. Men should talk to their doctor when A, they can't find the dairy section at the grocery store, B, they have a flat tire, C, they burn the pizza in the oven, or D, they begin to experience any concerning symptoms or changes in their body.
Well, I think I would say all the above.
I agree with you.
Yeah, and I make pizzas on the side, so I love that. I'm probably less good with a flat tire than, I always know where the dairy section is, but D is if they have any concerning symptoms or changes in their body. You know, common one is blood. If you see blood as a guy in a place that it shouldn't be, seek medical care.
Okay, good rule of thumb. Our next question. Men who have an enlarged prostate, A, need to learn how to knit, B, need to run 20 miles a day, C, should subscribe to a new magazine, or D, have many treatment options available to them.
Well, I love it. Yeah, D is definitely the right answer. Although I'm trying to learn to crochet here in the near future, long story. But yeah, definitely D. There's so many options when it comes to enlarged prostate. It's always a late stage if someone gets to the emergency department and a catheter has to be inserted or anything else. We want to get them way before that happens. So if they're going to the bathroom multiple times during the night, more frequent stops on the golf course or anything else, they should think, hey, I should seek help on this.
Okay, good advice. Our next question here. Blank raises your odds of developing prostate cancer to 1 in 3. A, dancing like nobody is watching, B, telling bad jokes, C, drinking wheatgrass, or D, having a dad, brother, or son who was diagnosed with prostate cancer.
Well, this is the easiest one yet. So it's definitely D. If you have a first-degree relative with prostate cancer, unfortunately, that really speaks to the genetics that you are a part of there, and it really raises the risks of you developing prostate cancer.
Okay. Next one here. Blank are 74% more likely to be diagnosed with prostate cancer and 2.4 times more likely to die as a result. A, a squad of influencers, B, a flutter of butterflies, C, a prickle of hedgehogs, or D, African American men.
I have yet to deal with a hedgehog, although I do know someone that owns a hedgehog. That's kind of fun. But it's definitely African American men and anybody that we would classify as black. So if they came from the Caribbean or other lands as well, unfortunately for them in their genetic makeup to have a higher preponderance of prostate cancer.
Okay. Our next question here. Blank can reduce your risk of developing prostate cancer. A, eating a healthy diet. B, maintaining a healthy weight. C, staying physically active. Or D, all of the above.
Yeah, this is the old doctor answer everybody loves hearing. Try and do all the above, and it's tough, but it's true when it comes to prostate cancer and overall well-being. Study after study that we do does show maintaining all those things contributes to better health outcomes in the setting of prostate cancer.
Dr. Maes, these were all really good points of advice that you gave us during the game, so thanks for playing.
Oh, my pleasure.
Okay, so is there anything else that maybe men should know about or you hear about often when you see patients?
Well, one thing that is sometimes awkward to have occur and even more awkward to bring up to a healthcare professional. But if there are any troubles with intimacy, certainly you can bring it up to me and I can help you in that regard. But the greater aspect there, it's also a precursor to more pressing medical needs such as heart attacks and other things. So if there's any trouble in that realm, say something to your medical professional. We're here to help.
All right, Dr. Maes, thanks so much for being with us.
Pleasure being here.